How can value-based care organizations efficiently deliver the highest quality care across multiple settings? True value-based care means being there for your patients, where and when they need it. But that can be difficult when healthcare is decentralized, health tech is location and encounter specific, and clinicians are burned out. CareAlign addresses these challenges by connecting teams across care settings and giving clinicians a tool to make managing patient care easier. Let's dive into an example. Meet Mrs. Smith, a 58-year-old patient of yours with a history of type 2 diabetes, coronary artery disease, and GERD. Recently, Mrs. Smith was admitted to the hospital for pneumonia, where she developed a blood clot. After her condition stabilized, Mrs. Smith was transferred to a skilled nursing facility and then discharged home to follow up with her PCP. As an organization managing Mrs. Smith's care, your clinical team has a lot to consider regarding her follow-up. Importantly, how her new diagnoses and treatments may impact her chronic conditions. How would your team go about managing this patient's complex diagnoses? Without a care team collaboration platform, clinicians are forced to rely on these inefficient methods. That's why we created CareAlign, to make it easier to find the most important information and necessary follow-ups in one place, driving better care and improving workflows. Using CareAlign, the entire clinical team can see Mrs. Smith's labs, vitals, and medication lists at a glance. They can also easily search for studies and quickly see the results. On the same page, clinicians can build their care plan note and add follow-up items for Mrs. Smith's chronic issues, as well as for her new conditions. Everyone can see when each item was completed, even if Mrs. Smith moves from one care setting to another. As a value-based care organization, we know that accurately and completely capturing a patient's diagnosis is essential, as this drives quality metric reporting and severity of illness assessments. That's why we made it easy to generate documentation from the work clinicians have already done. This ensures everything is captured while enabling clinicians to spend less time on administrative tasks. CareAlign improves collaboration regardless of where care happens, improving risk adjustment scores by 18% for similar organizations, while reducing errors and giving clinicians back an hour each and every day. Learn more at www.carealign.ai/value-based care.